Hello all, my name is Reggie Gackett and I want to welcome you to the 10th webinar of the year and the second webinar of the 2020 Spring Family Webinar Series. I am the Assistant Director in the First Year Center, and tonight I am joined by my colleague Carolyn Herman, Associate Dean and Director of Pre-Health Advising in the College of Arts and Sciences. We are excited that you have chosen to join us for tonight's conversation. Some information before we get started. First, you will notice that we've given you the ability to submit messages to us during the webinar using the chat function. Please use this feature to ask us questions. These questions will only be seen by staff in the First Year Center and our panelist, Dean Herman. Two of our professional staff members within the First Year Center are helping to field these questions. We will answer those we find applicable to the audience as a whole on this webinar, and we'll respond to more nuanced or personal questions via email next week. Let's go ahead and make sure you know how to use the chat feature. Send us a chat with the location you are watching from, and we'll name a few of these on the air. While that's going on, this webinar is being recorded live. Next week, we will upload this webinar to families.wustl.edu website. Lastly, in a moment, we will hear from our panelists about pre-med advising, or pre-health advising rather, here at WashU. If something our panelist says sparks a question, don't forget to chat us. After hearing from our panelists, we'll move to the Q&A portion of the evening. Before passing things off to Dean Herman, I want to share some of the places people are joining us from. We have families tuning in from New York, St. Louis, Missouri, among other places. Now, since I know you want to hear more about pre-health advising, I will turn it over to Dean Herman.
Thank you so much for having me, Reggie. Thanks to all the families who are joining us here in this webinar. I just wanted to say a few things about sort of how pre-health advising works at WashU. We assign pre-health advisors in the middle of the sophomore year, so that has already happened for this year. So if you have a sophomore or a junior or a senior who has either came to college with pre-health intentions or has recently started considering those, ask them who their pre-health advisor is. And if they don't know, they might not have been assigned one, and we'd love for them to be in touch, and we'd love to fix that. We are not trying to keep first-year students at arm's length. We love working with first-year students. We don't assign them a specific advisor because we don't want them to feel obligated to come and meet with someone before they may really be ready. So we want them to focus more on, making a really strong academic transition and not worrying too much about what's going to happen after Washington University right as they arrive on campus. But if your student is a planner, if they started preparing for college in 9th grade and you know that they're going to want to speak with an advisor as early as possible, we would love to see first-year students. We have online calendars, we have walk-in hours. Those are posted on our website. There's lots of great information on our website, actually, which is at prehealth, prehealth, so prehealth.wustl.edu. There are a couple of tabs on there. There's all kinds of information, but one of it is Meet Our Advisors. So they can see a list of walk-in hours and then online calendars. If they click on a specific person's name, a specific appointment calendar will be part of the information there. I find that students don't really use the website that much, and I think that's possibly a generational thing, but there really is a lot of good information on there. So if you want to learn more about how pre-health works at WashU, it is a public site. There's nothing that is WustL key or password protected on it, and we certainly invite you to spend time on it. If questions come up, that if you read something on there that you don't understand or that you want more information about, I absolutely welcome questions from parents by email as well. So check that out and feel free to be in touch with me. The other, I think, misconception that I end up clearing up a lot with students and sometimes their families as well is that students often are very focused on their numbers. They're worried about their grades. They're worried about their science grades. They're worried about their MCAT score. And I certainly don't want to suggest that those numbers aren't relevant because they have an impact. But the application is so much more than numbers. And I think that because it's difficult to quantify the rest of the application, that sometimes students de-emphasize it. So making sure that your student has a really nice track record in service exposure to clinical medicine, experiences that will help them describe their goals and motivation and help them have a compelling narrative about why this path in health, whether it's medicine or optometry or physical therapy or whatever it is, why is this the place for them to make their contribution that they have to make to society? That's super important and sometimes tougher to articulate and tougher for students to self-evaluate on. So I think their pre-health advisor will help them and coach them on that, but you can do some coaching at home too to help them.
Great. And as a note, we posted the URL for the website in the webinar chat. So if you're looking for that, it is in the webinar chat.
Well, why don't we take some questions?
Great. So thank you so much for sharing that insightful information. While hearing you speak, we had an initial question that I think many family members may be wondering. Other than becoming an MD, what are other pre-health careers that a student might consider?
We actually have a whole tab on our website that is entitled Health Career Options. And we really encourage students to shadow or do informational interviewing with a number of different health careers. If nothing else, even if they do decide that MD is right for them, I think you're a better team leader if you understand the different positions on the team. So we encourage students to work in healthcare positions in less glamorous roles like, CNA maybe, or scribe, because it helps them understand the entire healthcare setting. So it's really a great idea to go and really check out a number of healthcare professions. The popular ones here, besides MD, are dentistry, nursing, physical therapy, occupational therapy. We have very strong programs in both physical therapy and occupational therapy at our own School of Medicine. And we actually have a 3-2 program with the occupational therapy program. So those draw a lot of people, but we've got specialized support for, a lot of other eventual, sort of healthcare intentions as well. So there are lots of great options out there.
Thank you. So we're going to move on now to the question and answer portion of the evening. As a reminder, chat us the questions you have and we'll answer as many as possible during this webinar. Our first question is, will my student be better prepared for a career in healthcare if she were to choose a major focused in the sciences?
It really absolutely does not give your application an advantage to have a science major. There are certainly some courses that you have to take in order to be prepared for the curriculum in medical school or dental school or, sort of whichever profession you're pursuing. But those courses can live alongside absolutely any major in arts and sciences. So, I have students who are science majors who are applying to medical school. I have students who are non-science majors who are applying to medical school. I have students who double major in a science and a non-science. And there is absolutely no benefit or disadvantage to any of those choices. As long as students are choosing to study things they are genuinely enthusiastic about, so that in those conversations, in the interview, when they're asked about their course of study, they can sound, like generally, genuine and enthused and excited about their academic work. That's what's key.
Great, thank you. So we have a family member whose student is a rising senior and has not yet had an internship or an opportunity to shadow in the healthcare field. Are there still opportunities available to them?
So if they're in the middle of, if they're in the middle of their junior year, there's still certainly a lot that can happen. We really encourage students to connect, first of all, with their network at home. They should be in touch with their pediatrician, especially if their pediatrician was part of their inspiration to, pursue this path. That grown-up would love to hear from them and love to know that, they touched a young person. So the student's own doctors, their parents' physicians, friends' parents, and parents' friends who are involved in healthcare. They should be in touch with all those people when they're home over breaks. If they're home for the entire summer, there's lots of opportunity there. But even if they're just coming home for spring break or for a couple of weeks before they come back to campus to do some research or something, there could be time for some, substantial shadowing with healthcare professionals they know at home. So that's one. one opportunity that we encourage students to pursue. We have courses as well that they could take in their senior year. So there's a course where they can shadow in the adult emergency room called MedPrep. There's also a course where they can participate in clinical research in the children's emergency room called PEMRAP. There are some other courses where they might get involved in more sort of individual clinical research projects. So they should certainly be strategizing with their pre-health advisor. If they're already a junior, need to be, in touch with their pre-health advisor and making a plan. But there's definitely opportunities still. And the other thing I would say is that if students arrive at, the end of their junior year or the end of their senior year or whenever it is, and they feel like they don't have the kind of rich experiences that allow them to craft a compelling application, they should just wait. They should get a job, a postgraduate, and apply after they've been working in healthcare for a year as a medical assistant in a private practice or a physician facilitator at an urgent care or whatever it might be. But they could work for a year and take 2 gap years. There's nothing wrong with that. And lots of my students do actually make that choice.
Great, wonderful. Thank you. So you mentioned CNA positions in your opening remarks. What is a CNA?
CNA is Certified Nurse's Assistant. So it is not a glamorous job. You're going to basically be doing all the sort of chores that, that the RNs are kind of, their qualifications mean that they're going to be doing something else. But it is certainly firsthand, and sometimes hands-on patient contact. So maybe, administering medications, and obviously anything that you would do that would be required actually touching the patient, you're gonna be trained for. It's a job, and so you get trained. But nursing homes a lot of times have CNAs.
And you mentioned that this is something that really gives students an opportunity to see healthcare from one of the many different opportunities that they would be, or one of the many positions that they may be interacting with when they eventually get there. Is that something that students would consider doing, say, over the summer or in between academic years?
Yeah, most of my students who actually work in a healthcare setting start in some kind of a summer job. That's I wouldn't say always, but that's common. So a lot of times they'll start in a summer job at home, possibly here in the area, and then maybe they work part-time during the school year on a limited basis. Obviously, we don't want them spreading themselves too thin, but most students can, work a little bit and still, do excellent academic work. Sometimes that also then matures into something they do in a postgraduate year, either while they're applying and interviewing or while they're, kind of collecting experience to prepare to apply.
Great, thank you. When do you suggest that students take the MCAT?
I think the best time to take the MCAT is when they are really prepared for it. So that's definitely going to be all after they've had all the coursework that is relevant to or tested over on the MCAT. For most students, the earliest that would be January of their junior year. Very few students will have had all the coursework that's going to be covered on it before then. So earliest would be January of junior year, but plenty of my students really don't want to try to balance studying for the MCAT across a full load of academic coursework, and they'd prefer to take it in the summer. I recommend that they take it then the summer after their junior year so that they've had all the coursework and had some upper level bio courses in particular will help them prepare and help them develop some skills for the biology section of the MCAT. And then if they take it at the end of that summer, they spend the summer studying, maybe while they're doing some research or some type of a clinical job, working part-time, they still will have time to study. Most students, if they study for a full summer, will be well prepared, take it at the beginning of the fall of their senior year, and then they'll apply at the end of their senior year, be working while they're interviewing in a gap year.
Great. We have a number of folks who are asking, are medical schools okay with folks taking prerequisites such as physics or organic chemistry over the summer at a different institution than their home institution?
Yeah, a lot of my students do that, and my students are going to medical school, so it really just can't be that big a problem. I don't think it's any huge disadvantage. I think if a student is appears to be avoiding difficult coursework, if they've really, sort of been struggling academically, then they should think through carefully sort of how they plan, to demonstrate sort of a recovery and skill building. And that's a strategy conversation to have with your pre-health advisor. But by and large, if students have been performing relatively well in their coursework, I don't think schools are, sort of investing that much meaning in any particular course in the requirements.
If my student graduates from WashU, will they also be able to attend medical school here as well?
They might. The class at Washington University School of Medicine right now is 80 students. They've scaled it back just a little bit as they do some curriculum changes over there. They wanted to have a little bit smaller group to work with while they, sort of maybe ironed out any wrinkles in the new curriculum. So we have probably on my MCAT, sort of summary report right now, I have 350 people applying. So they're obviously not all going to Washington University School of Medicine, but our students do get a little bit of an advantage there. They get a little bit of a bump, and we will have the largest number of students at any one institution is at Washington University School of Medicine. So we send more students there than to any other single medical school.
Great, thank you. Are there systems in place to support students who may not have the financial capability to actually do the application for medical school or to take the entrance exams or the MCAT or those pieces?
That is such a great question. I'm glad you asked that because it's really a tricky space. So I just somewhat recently learned within the last few years that our financial aid awarding package cannot include things for postgraduate. Like you can't, the student financial services cannot award as part of the financial aid the cost of a GRE prep course or an MCAT prep course. The like federal financial aid laws actually restrict that. That's not considered part of cost of attendance. I think that's wrong, but my opinion does not matter here. So we have had to really work hard and really be creative in terms of finding resources because it can't just be part of the financial aid package. If students are part of a program like Deneb Stars for encompasses some first generation students and some students who are from lower income families, they should certainly be asking their program directors about resources because certainly students who are TRIO eligible, there's some money in the TRIO program for things like that. So if they're already connected to any kind of a program, they should absolutely be asking, how can you help me get this done? If they're not connected to any program, they still should come and talk to somebody in the college. We don't want anybody to not pursue their dreams or not achieve their goals because they've got financial barriers. And we really want to try to find the resources that students need. So their first point of contact would be any program that they're already affiliated with and known by. But if that is not working for them or they just don't have a home like that, they should come to the college office.
Great, thank you. Are there clubs or organizations that exist that can add to my students' experience as a pre-health student?
There's so many clubs and organizations that students participate in that can really, sort of enrich their understanding of medicine. There are lots of clubs that have, as part of their activity together, they volunteer together at Children's Hospital. Like Project Picasso goes over to Children's and does art projects with the kids. Einstein Explorers goes over to Children's Hospital and does little science demonstrations in kids' rooms and stuff. So there are lots and lots of clubs and activities where students can get great patient-facing experience, learn more about healthcare, learn more about even health policy and healthcare systems. There's almost too many sometimes I think it's hard for students to figure out sort of which to engage with because there are almost like too many options. I encourage students to talk with the upper level students, their WUSAs, their RAs, even if they're not pre-med, they have friends here who are. Talk with them about what kinds of experiences they've either had or they've had, heard their friends really enjoying, and talk with them about why they liked those. And then that, I think, will help them sort through a little bit what would be a good fit for them.
Great.
So I think that mentoring from upper level students is really helpful there.
So if a student has an opportunity to shadow a professional in the medical field, what would you suggest they do to get the most out of that experience?
I mean, the first the first piece of advice is really just, be very professional, dress appropriately. Medicine is conservative. You should be wearing a tie if you're a young man. You should be wearing, slacks or a conservative dress if you're a young woman. But then when you're there, also always let the healthcare professionals take the lead. You should be in the background unless you're invited to step forward. In terms of what you can do, really journaling afterwards so that you capture those experiences, you capture those emotions that you had during the experience, you capture any learning that you had, any questions you have that you might be able to, ask either a healthcare provider or research on your own in some way later. That journaling, I think, is really crucial.
So we have a parent who asks, my student wants to take a gap year before medical school. Besides studying for the entrance exams or MCAT, what do you recommend they do during that year?
I assume that all of my students are going to work during a gap year, because I assume that they're going to be at least partly financially responsible for themselves. I mean, when I first went to graduate school, my parents still paid my car insurance. And, I'm sure that, many students in their gap year, their parents will still be paying for their phone or, whatever it might be. But they're probably going to be paying some of their own bills as well. So we expect them to work. There are lots of great jobs that will actually be helpful to them and to, as they're heading to interviews or writing their application materials. Lots of my students work in clinical research. There are lots of 1- and 2-year jobs in clinical research. There's a little bit of a revolving door at our own School of Medicine of people who, have these sort of gap year jobs and then pass them on to other people. They could work, in a medical office of some kind or a direct healthcare setting, ER tech, scribe in an urgent care or an emergency room, work in a nursing home, something like that. The third most popular option is some type of structured gap year program like AmeriCorps. A lot of those are in under-resourced schools. There's a teacher's assistant or something. I still think that can be a genuinely beneficial way to really understand the day in, day out lives of, people who will be part of your patient population, particularly if you're training, in a medical school whose teaching hospital is in an urban core or is a safety net hospital.
We have some family members asking, does lab work that is paid versus through coursework differ in credibility towards medical school applications?
No, not at all.
Okay.
I think medical schools don't care at all whether you're being paid or whether you received course credit. I think what they do care about is that you can talk about what you did. You need to understand what you were doing and be able to articulate the contribution that you made, as well as sort of the lab's purpose. Why are they bothering to study this?
So we have a family member who asks, my student has been struggling academically in the pre-health courses here. What support systems are in place at WashU to help them? And what advice do you have to help me support them as well?
So the core science courses here are challenging. There is no doubt about that. And depending on what their high school, situation was like, people come in with different levels of preparedness for these very challenging courses as well. So I think if they are struggling, I would be asking them, there are a lot of resources here. There are a lot of study groups. There are a lot of, we have what we call residential peer mentors. So there are students who are actually being paid to hold sort of office hours in the dorms to answer questions over chemistry and biology and math. So asking students sort of which of the resources they're taking advantage of and how they're utilizing them is a good way to sort of open a conversation. Sometimes part of the problem is that students are really just too embarrassed to ask for help. It's a very big identity shift to not be the smartest kid in the room all the time anymore, because that's where most of them have come from. And so sometimes it really is just getting over that hump of being willing to admit to somebody that you really need, some assistance. So letting them know that that's okay, maybe sharing a time, in your own life when you had to, be very humble about something and, you know, ask somebody for a lot of help and assistance, and then in the end you were really successful, that could be powerful.
Yeah. What resources does WashU have to help students prepare for the medical school interviews?
Our Career Center does a great job with that.
Mm-hmm.
We've got several physicians who
Mm-hmm.
are part-time employees at the Career Center who conduct mock interviews for medical school, and they do a great job. But there are also just other Career Center specialists who've really learned about interviewing at medical school, who conduct mock interviews and give great feedback,
Yeah.
and are really helpful to students as well. We've got some group programming too. There's an improv style, you know, sort of, just get practice thinking on your feet,
Right.
practice sort of, you know, sharing your elevator pitch. So for younger students, I think you can never start that stuff too early.
Yeah.
You know, go and participate in some of the group things at the Career Center. And then there's also an online tool called Big Interview that they can, sort of practice individually with, or, you know, get critical feedback from family or friends. But certainly in the academic year leading up to when they'll be applying, we want them over at the Career Center doing those one-on-one mock interviews with professional staff.
Great, thank you. Does WashU host a pre-health career fair? If so, how should my student prepare for an opportunity like that?
We don't have a pre-health specific career fair. A number of the companies that recruit a lot of students for gap year jobs just come to our regular career fair.
Wonderful.
And so I certainly encourage all of my students that I'm advising to go to that. You know, they may connect with, a great opportunity there. But we don't have, say, a fair where, you know, medical schools are like all in a room at tables.
Right.
We have a fair number of medical schools who do visit at various points over the year and come here to recruit. We advertise those through our pre-health email listserv. There's usually either, you know, some sort of lunch meeting or late afternoon, an hour session where the medical school presents and answers questions. And so we certainly, you know, encourage students to attend some of those. Even if they don't think it's a medical school they're going to be super interested in, you can just learn a lot about how medical schools differ from each other by going to these.
And then what is the best way for me to encourage my student to get on that pre-health listserv?
If they are not already getting the pre-health emails, they definitely should email us at prehealth.wustl.edu, and then we will add them to the listserv. Sometimes they're on it and it's just going to their spam. And sometimes that's because they got on the list very, very early, and then we sent a lot of email that never interested them, so they marked it as spam, or their mail manager asked, do you want us to put this in the trash for you? So sometimes they just have to reteach their mail manager to send it to their inbox instead of their junk.
Great, thank you. Where should students go to find research opportunities?
We have an undergraduate research office, and they want to work with students. They want to help students with that. I suggest to my own four-year advisees, when they are, early on, maybe first year or first summer, they want to start looking for a research opportunity. I urge them to go to the undergrad research office's website. There's a Getting Started tab on the website, and it is really full of great information. And I think if students will read through that and do some self-reflection and some thinking, and then schedule a meeting with, you know, one of the advisors in the undergraduate research office, they will have better questions and they will get a lot more out of that visit.
Great. We're going to go ahead and put both the pre-health email as well as that website also in the chat function for you. Where will this webinar be posted afterwards so we can direct our students to watch it? So I'm going to answer this one. The webinar will be posted on families.wustl.edu, and we'll also post that into the chat function for you all. So that way you can direct your students there, and it will be up next week. What are the chances of WashU graduates getting accepted to medical school? How many schools do most people apply to?
So all of my students are going to be accepted to medical school eventually.
Yeah.
It's really true. It is a question of, for everybody here is smart enough to be a doctor. And if they really want it, and, they're sort of going after it for the right reasons, they've done that, sort of discernment piece. They know that it's a good fit for them in terms of their values and the kind of work they want to do, they're going to be successful in the application process. 80% of our applicants are successful the first time.
Yeah.
So the other 20% reapply, and then they go.
Yeah, great. Do you find that pre-health students can study abroad while meeting all of their requirements? If so, are there specific programs that they may be able to do?
I encourage my students to study abroad. And that's probably the thing that has perhaps changed the most since, the parents who might be my age watching, especially if they were science majors, study abroad was not a thing when we were kids in college, if you were in science. And that's not really true anymore. Now, if you are there are a couple of majors where it can be a little bit difficult to schedule it in unless you move a sequence to the summer. So and the question, is it really okay to take organic or physics in the summer? A lot of my students are moving one of those sequences to the summer after their first year so that they can free up their junior year. They're not doing a year-long sequence in their junior year, and they can study abroad one of those semesters, often junior spring. And that works really just fine. And that's a great reason to take coursework in the summer. So that I could create room for study abroad is absolutely an answer that medical schools will value.
Great. As a side note, we will be doing a study abroad webinar on Monday, March 9th, where you can find out some more information on the study abroad specifics and whatnot. Our next question, do you assist students who have already graduated and are taking a year or two before the application to medical school?
Absolutely. We love to work with alums. And we want people to apply when they're ready. The fact that we push that philosophy, so assiduously means we really have an ethical obligation to follow up with that and be ready to advise them when they're ready to apply. And we are. I have students who go and serve in the Peace Corps, come back 3 years later, find that they have decided on medicine while they were in the Peace Corps. We love to help them apply. So there's no amount of time that you can be out that's too long where we're not interested in helping you anymore. You're always ours.
And then for those students who may be away and have an experience like that, what is the best way for us to get them in contact with you all?
Mostly students will email me first. And then, I've got an online calendar. We can work by phone. Some things are well handled by email, many are not. And a conversation is better, depending on where they are and, sort of what our hours are and stuff, maybe Skype will be good, but we can always figure out a way to communicate. And it does not mean they have to travel back to St. Louis. We're set up to work remotely with them.
Great. So one family member asks, my student decided that they wanted to join the pre-health track as a sophomore. Will they be on track to finish the pre-health timeline and or graduate within that 4 year?
They will absolutely graduate on time. All of my students must graduate in 4 years. A few are going to have some really hard medical issue where they have to take a semester out. Maybe they'll have to stay another semester. But the goal is everyone graduates in 4 years. It may be, depending on the pace at which they pursue the coursework. They may finish all the coursework before they graduate. That would be lovely. They might have 1 or 2 courses that they need to do after they graduate, and they could do that at home inexpensively at their state school. So it generally is not advisable to sort of cram everything in to get it done, just to hurry through it. Especially if a student's starting, maybe not as a, but students who are starting as a junior or a senior and have been away from the science coursework for a long time. It now feels like a long time since 10th grade, the last time they saw chemistry, for example. That you don't want to pile on a lot of coursework that is, that you have a big distance from the sort of preparation for that all at once. So a gentle ramp into it is advisable. If that means that it's not all going to be done on graduation day, that's really okay.
Great. How many schools do most people apply to?
I would say that the number of schools that I recommend that students apply to is 15. A lot of my students get very, very scared. It's a very anxiety-inducing process. I understand that. And they add in a bunch at the last minute. I don't believe that improves their odds at all.
Yeah. Okay. If my student has transferred into WashU from another school and completed some prerequisites for pre-health at their former institution, will those credits work for medical school applications?
Absolutely. They're going to send original transcripts from every college or university they've ever attended. That includes summer coursework. That includes actually, if they have college transcripts from high school, like here, if you went to one of the Catholic schools, they have that 1818 program with SLU.
Right.
So a lot of kids that, graduate from schools here have a college transcript from SLU before they ever go to college. We actually won't take that credit here at WashU, but you still need to send your SLU transcript when you apply to med school. So all of those transcripts both will be acceptable and utilized by medical schools, and you're obligated to provide them.
Great. Now that Med Prep, which is one of the courses that you'd mentioned earlier, now that Med Prep Fall Study Abroad in China has been canceled due to COVID-19, will there be a substitute Med Prep offered elsewhere?
Well, I mean, we have the main Med Prep is offered right here at the Barnes Jewish Emergency Room.
Right.
So this was sort of a spinoff that was offered in China. I don't know if we will set up another location, but it won't be this year because it just takes too long to we set up field experiences for them. They have this, it's just, there's a lot of groundwork and a lot of infrastructure involved in a program like that. And there's no way we're going to pull that off like by next fall.
Right.
That's not going to happen.
Right.
So everyone feels terrible about that. Everyone very much regrets, but it really was a safety decision. So
what kinds of experiences should my student be looking for to help with medical school applications? So we've talked about some pieces around research, some pieces around shadowing, some pieces around like work. So what kinds of things should they be looking for?
Every applicant must have a strong record of community service. Medicine is a service occupation. It's a well-compensated one, but it's still a service profession. And, you're going to often prioritize your patient's needs over your own. Sometimes you may prioritize your patient's needs over your family's needs. So, you have to demonstrate that comes naturally for you, that's just who you are. So that is not something they want to hear you talk about. That's something they want to have seen that you have done. So you can't have too much service. And the other thing they really need are those firsthand clinical experiences. You need to understand the role of the physician if we're talking about medical school, the dentist if we're talking about dental school. So you need to understand that provider role. You also need to have your own firsthand experience with patients. People are not at their best when they're in, healthcare settings. When they're ill or injured, they can be cranky, they can be, difficult. You need to firsthand engage with that and make sure that that's a good fit for you, that you enjoy that work, that you don't find it draining, that you find it energizing.
Do medical schools put weight on the specific institution that you take your summer class at?
I don't think that that's critical. And I especially want to assure families who are, kind of struggling a little bit to, scrape together money for summer tuition, that they do not have to send their kids here for summer school. Organic chemistry here is like $10,000. I have a child here at the institution as well. If she needs any summer classes, they will not be at Washington University because my faculty benefit does not cover any summer classes. And I can't afford it. I can't afford it. And so families do not need to feel like they have to, take on large extra debt. If the resources are there and there's a convenient or really strong program, sure, that's lovely. But if the resources really are not there, I think it is fine to choose something you can afford.
Great. Does community service have to be health related?
No. In fact, some medical schools, now this varies a little bit by school, honestly. Some medical schools actually really pay more attention to non-clinically oriented service because they feel like the students who, did some volunteering at a hospital or whatever, but then they also engage with the community beyond that, that their sort of commitment to service is sort of more genuine. It wasn't just a checkbox for the application.
Yeah.
So different admissions offices sort of have, a little bit different philosophies. It varies a little bit, but there are many that actually value the sort of non-clinical service above even the clinical service, although most will expect some clinical service.
Right. Does it matter to schools what type of doctor you would like to be?
No, and in fact, if you go in saying that you are for sure going to be an orthopedic surgeon and there's nothing else you're interested in, that may not net you an acceptance to medical school. It's good to be, so medical school is another general education.
Yeah.
And you declare your major in residency. So it's good to go in open-minded about exploring the majors that are possible and not declaring before you even start.
Right. So how many students take a gap year after undergraduate before attending medical school?
So not just at Washington University, but nationally, slightly more than half of seated medical students had time out in between undergrad and medical school.
Wonderful. So we're going to ask one last question for the evening. As a reminder, any questions we were not able to answer during the webinar will be addressed directly via email to the person who posed the question. Dean Herman, thank you so much for the information you've shared tonight. What is one last piece of advice for families of WashU students studying on the pre-health track that you would give them?
This is so hard, and I don't know how much impact families can have on this, but even if it's, chipping away at the edge, it can't hurt. A lot of students here spend a lot of time comparing themselves to each other, and it's just not very productive.
Yeah.
They're all going to be successful. They're all going to be successful, and they are good enough. They are enough just the way they are. And so they generate a lot of anxiety. They do a lot of comparing, helping your student focus on, competing with themselves and not with their suite mate, sort of their personal best, and, tracking their own progress, charting their own path, doing things that they really enjoy for their own reasons is probably the healthiest choice that they could possibly make.
Dean Herman, thank you so much. We really appreciate the information you provided this evening. I know it was extremely helpful to many of our family members.
Well, I'm happy to be here. Thank you for having me.
So families, we hope you were able to learn some valuable information this evening. Stay tuned for our next webinar, a conversation about study abroad, occurring on Monday, March 9th. You'll be able to register for this webinar at families.wustl.edu. We'll see you then.